My name's Clay Ibsen, and I live in Visalia, California. In my working in the industry, and as I've started working with education groups, there's a lot of really great work being done. Unfortunately, the ties aren't as strong as they could be oftentimes between employers and education. I think this is where we see an opportunity for HealthForce to help connect and strengthen those relationships, because that's also how we're going to really help in this workforce shortage, is making sure that we have good partners together, that employers and education are being collaborative. I think people would love to be in healthcare if they really understood the great amount of diversity that there is in healthcare careers. If you're not a blood and guts kind of person, there's more than just being a physician and a nurse, which are great careers, but there's so much more out there. And I'm hopeful that we can really help people understand what a great career could look like here in the Valley.
Tell me about the need for healthcare.
The need for healthcare right now is so great, especially here in the Central Valley, but in rural communities throughout the United States. The need for more healthcare workers has only increased after COVID. I think the need for all levels of healthcare careers, whether it be at a hospital, in an outpatient clinic, in a skilled nursing facility, those demands are high. And I'm hopeful people understand that there are fantastic careers available that their own communities really need them to come through and deliver on. There can be a lot of barriers, and some of them are just perceived barriers. Maybe I don't know enough about a career, so I'm not going to look at it. A lot of times families may not have been in healthcare, and so young people don't always understand what opportunities there might be. One of the biggest barriers is a perception that it's going to cost too much to be in a healthcare career. There's so many great resources out there for our young people to get involved and be a part of it. I'm just hopeful that they understand that there are so many partners out there willing to help them get through those barriers. Unfortunately, in this area, there's also barriers around just even enough opportunities to get into an academic program. And we're really hopeful that we can help people expand those opportunities for young people. The demand is so high right now in the healthcare industry for more workers in all levels of healthcare careers. That demand is especially high here in the Central Valley. And I think we want to make sure all of our community members know that demand needs to be filled. And it's only going to be filled to the best effect by local young people coming into those careers. They've already decided to make this their home, and they're going to continue to make it a career and a home here in the Central Valley. I'm hopeful we can help in delivering that.